So the most common reason people come to my office is typically incontinence. And I have a couple theories about why this is, but when you start leaking, when you cough, laugh, or sneeze, or when you try and play with your children or your grandchildren, or you try to exercise to stay healthy, it starts limiting your quality of life very quickly. And incontinence can actually occur during intimacy as well, both stress and urge. And so when these things happen, they have dramatic impacts on quality of life, and they're things that are hard to hide. And bracing when you cough, laugh, or sneeze, some people see that. But when you can no longer wear anything other than black pants because anything else shows that you're leaking, it changes how you dress. It may keep you from going out. And so probably incontinence is the most common reason people come to my office to see me. Interestingly, incontinence is also the most common reason for nursing home admission for women. It tends to be the straw that breaks the camel's back in terms of helping take care of you as you get older. And incontinence may increase your risk for things such as bladder infections, skin irritations, vaginal cancers, because the constant wearing of a pad irritates the vaginal mucosa or irritates the outside lining, which then opens the door for these things to occur. So incontinence is probably the most common reason people come to my office. During the evaluation for incontinence, we often find other things. So it is rare that the urethra has started to drop and the bladder hasn't dropped. It's rare for the bladder to drop and not pull either the uterus or the top of the vagina down with it. It's rare for the top of the vagina to drop and not pull the rectum down with it. So if you envision it sort of like a sock, for one part to fall, it pulls another part. And if that part falls, it pulls another part. So very rarely do these things occur in isolation. Does that mean we need to fix everything? It does not. We fix the things that are most symptomatic first. But it may mean that if we're going to go in and lift the bladder, we lift the rectum and the top of the vagina while we're there. And at that point, if you said, should I have a hysterectomy? We may consider a hysterectomy. If you're worried about things or you're having symptoms, it may be at the right time to do something. The good news is that most of the time, we do minimally invasive procedures. So typically people are in the hospital for one night. And technically, we bill it as an outpatient procedure. It's called a 23-hour observation. This helps control costs for you. It helps minimize the time you're away from family and friends. And it doesn't mean that you cannot stay longer if you need to, but it makes things safe. The reality is many of these surgeries I could do as a true outpatient surgery. You could go home that day. I often keep people overnight for me more than for them, but in the right patient, in the right situation, we may do it as an outpatient procedure, truly outpatient.